Thank you, Mr. President. I'd like to talk a few minutes about health care and the need for health care reform in the country today. I think most Americans would agree that we need to do everything we can to make affordable health insurance available to every American. And hopefully that's what this health reform debate will be about. Unfortunately, we're seeing a pattern develop here that's been going on all year since the President took office that has many Americans alarmed at the rapid pace that we're spending and borrowing and proposing new taxes and taking over various aspects of the American economy. I know a lot of Americans are alarmed, some are outraged, and more than any other comment, I'm just hearing Americans say, why don't you just slow down and read the bills before you continue the expansion of government? Now we're talking about health care, and we see that same pattern of crises and rush and has to be done today, hair's on fire type of mentality here in Washington that we almost have to call this a son of stimulus health care bill. Because certainly the last time the President tried to ram a massive bill through Congress before we had a chance to read it, we ended up with this colossal stimulus failure that has actually resulted in the loss of jobs in America and a burden of debt on our children that is almost unimaginable. It makes no sense for us to follow that same pattern with health care. Nearly 20% of our economy to have a government takeover with a bill that we haven't even completely seen yet that's supposed to be passed in the next 2 weeks, even though the bill wouldn't take effect until 2013. What's the rush? The whole purpose of the Senate is to be the place where the legislation comes to cool down, where we deliberate, we look at the details. And the President himself has admitted he's not aware of the details of the bill that he is out selling every day. We do have serious problems in health care that we need to fix. The unfortunate thing is I have no confidence that the President actually wants to make health insurance affordable and available to all Americans. Because when he was in the Senate, Republicans proposed a number of alternatives that would have done just that. Yet in every case, every opportunity that he had to make health insurance more available and affordable to Americans, he voted no. Let's just review some of them, because I really think we have to recognize that the point of this health care debate is not to make sure every American is insured, but to make sure the government is running our health care system, the most personal and private part of our lives. They're talking about turning over to bureaucrats at the federal level. This makes no sense. One of the basic things that we could do is to be fair to those who don't get their health insurance at work. If people get their health insurance at work, as we do here in Congress, your employer can deduct the cost of it, and the employee is exempt from paying taxes on those benefits. That's equivalent to about a $5,000 a year benefit to families who get their health care or health insurance at work. Why can't we offer that same fairness to Americans who don't get their health insurance at work? It's something that I actually proposed here in the Senate while President Obama was a senator, that we would give fair tax treatment, at least let them deduct it from their taxes. He voted no, as did, I believe, every Democrat, and they killed the bill in the House. This was just basic fairness to make health insurance a little more affordable to people who didn't get it at work. The President voted no. You hear a lot of talk of we need a government plan to make the private plans more competitive. Why not just make all the insurance companies compete with insurance companies all over the country instead of what we do now? A lot of Americans don't know that the reason we don't have a competitive private health insurance market is that the federal government makes it impossible. You have to buy your health insurance in the state where you live. So a few insurance companies basically have monopolies in every state of the country. What if someone like me who lived in South Carolina could look all across the country, find a policy that I wanted at a better price and buy it? Why can't we do that? Well, I propose that we do that. We introduced it on the Senate floor that would create a competitive health insurance market and allow people to buy all over the country. Barack Obama voted no, as did all of the Democrats, to kill a bill. Now they're talking about, well, we need a government option to create some competition. But to have a real competitive market, he voted against it. What about allowing Americans who put money in a health savings account, or their employer puts it in there for them, their own money? Why not let them use that money to pay for a health insurance premium if they don't get it at work? Well, it sounded like a good idea to me. Make it a little bit easier, a little more affordable to have your own health insurance. So I proposed that bill here in the Senate. Barack Obama voted no, as did all of the Democrats, and they killed the bill. What about the idea of allowing a lot of small employers? I was a small businessman for years. It was hard to buy health insurance as a small employer, but I did. It cost me a lot of money, a lot more than the big employers. But what about allowing a lot of small employers to come together and form associations and buy health insurance so they could offer it to their employees less expensively? Well, it's a good idea that was offered right here on the floor of the Senate by Republicans. Barack Obama voted no, as did most of the Democrats, and they killed the bill. There's a long list here I could go through. But every single bill, every single health reform idea that has been proposed here, the President, when he was in the Senate, voted against it. Everything that would have made health insurance available and affordable to the average American who doesn't get their insurance at work was voted no by this President. And now he's saying, we need the government to take it over because it's not working. The reason it's not working is we won't let it work. The part of health insurance, the health care system that works the best today is when you have your own health insurance and you pick your own doctor and you and your doctor decide what kind of health care that you're going to get. It's not a perfect system, and insurance companies have a lot of work to do to make things work better because I have to argue with them a lot myself. But the part of the health care system that doesn't work is the part that the government runs. Medicaid and Medicare, the S-chip and TRICARE. Now, some of the people who get those benefits, like our seniors, say Medicare works just fine. But unfortunately, doctors don't want to see them coming because Medicare and Medicaid don't cover the cost of even seeing the patient. And so many physicians are closing their practices to our seniors because they have government health insurance. Government health care does not pay enough for the physician in the hospital to see the patient, so they shift the cost over to the private market. And the worst part of all of these government plans is they're trillions of dollars in debt, debt that our children are going to have to pay back. These programs are broke, yet they want to expand these programs. They want to take the part of health care that's not working and essentially force it on every American. They want every American to have a Medicaid plan where doctors don't want to see us coming because we're not paying enough of their cost. Folks, as I look at this whole health care reform debate, and I'm glad to see the President out taking shots at me for saying we've got to stop him on this, because we've been on a rampage since he took office, passing one government program after another, expanding spending and debt at levels we've never even imagined in this country. It's time to slow down and take stock of where we are. Other countries that have to lend us money to keep us going are beginning to wonder, can we pay our debts? We've doubled our money supply by the Federal Reserve, and that means big inflation, higher interest rates, and yet we're moving ahead with this health care plan that's going to expand our debt as a nation, raise taxes on small businesses that create the jobs. It looks like we're going to penalize Americans who don't decide to buy health insurance, and we're moving again towards a government program that we know won't work. There's not one federal program that has worked as advertised, that has worked to the budget that we said it would be to. And this week we've had announcements of what we've already passed as far as stimulus over the last year is going to mean trillions of dollars that we're going to have to borrow, that our children are going to have to pay back. Now, my appeal to my colleagues is this. We don't need to rush through a bill in the next 2 weeks before we go on our August break that affects 1/5, 20% of our total economy, that gets the government to effectively take over the most personal and private service that we ask for as Americans. We don't need to pass a bill like that we won't even have time to read. What the President and I think a lot of the proponents of this bill are afraid of is if we're able to go home on the August break and we take this bill and we put it on the internet where people can really read it, and radio talk shows and bloggers all around the country are able to tell the American people what this bill is and what it will do, and get past this utopian rhetoric that we're hearing from the President and really look at the nuts and bolts. Because everything he's saying this bill is going to do, the Congressional Budget Office and other experts are saying, no, it isn't going to work that way. It isn't going to save us money. It's going to raise our taxes. It's going to cost jobs in America, and it isn't going to fix health care. We need to go back to the basics. Some of the things that I've already mentioned that would really reform health care and make private health insurance work better, make it more affordable, and get it into the hands of more Americans. Why should we give up on freedom and move to a government plan when we haven't even given freedom a chance to work in health care? I know the government can't run health care, and I don't want them running my plan. One of the best ideas I've heard in this debate is whatever we pass, congressmen and senators ought to have to take that health plan. And I'm going to have an amendment to that effect if they try to get this on the floor before August. But I appeal to my colleagues. Let's listen to the American people. Let's stop this rampage towards bigger and bigger government. Let's take our time and look at this bill and for once do something right. You know, our health depends on it. Thank you, Mr. President. I yield back.